Well, good morning, everyone. It is November 29th, 2021. It's 10 a.m. and I welcome everyone to the public meeting of the USDA Emergency Rural Health Care Grant Program. This public meeting is being held to inform the community about Mid-State Health Center's intent to purchase equipment, furnishing, and non-consumable supplies required to provide primary care services, including COVID response activities at Mid-State's new acute walk-in care location at 28 Main Street, Plymouth. This project will be funded by the USDA Rural Development. This public meeting the public will be given an opportunity to become acquainted with the project, provide input, and ask questions about the project. And before we begin, I would like to do introductions. My name is Bob McLeod. I'm the CEO of and
Wendy Williams, Director of Grants and Programming, Mid-State Health Center.
Financial Officer for Mid-State Health Center.
We'll go to the screen. I'll start out with Samantha.
Hi, I'm Samantha Hooper. I am the Marketing and Communications Manager at Mid-State.
Josh.
Hi, I'm Josh. I'm Director of Facilities at Mid-State Health Center.
And Amanda.
I'm Amanda Bennett. I'm the Assistant Finance Director at Mid-State Health Center.
Thank you. Is there anyone that I have missed on this virtual meeting?
This is Audrey Gowdy. I'm also in attendance.
Thank you, Audrey. Is there anyone else? Okay, thank you very much. Mid-State Health Center is a federally qualified health center in Plymouth and in Bristol, and we provide primary care services that include mental health services, oral health care, as well as medical primary health care services. Our mission is to serve everyone in the community, irrespective of their ability to pay. With that, I will turn this over to Wendy Williams, who will review the project at 28 Main Street.
Good morning. Mid-State Health Center has a property at 28 Main Street in New Hampshire, and we intend, that was a former bank. We intend to renovate some square footage of that space to provide primary care services to the downtown Plymouth area. It will include 12 exam rooms and offices, as well as upgrades to laboratories and a waiting room space and a conference room. The goal for the USDA funding would be to help fund the actual outfitting of the space, which will include things like furniture, non-consumable supplies, and really just the overall movable equipment that we can use to deliver primary care. One of the goals of the project is to also provide COVID response at this location for the future, which would include testing and also vaccination opportunities to serve the more walking population of the downtown Plymouth area.
Thank you, Wendy. Next, we're going to talk about project funding, and for that, I'm going to turn it over to our CFO, Bill Sweeney.
Well, Wendy kind of covered it, but the USDA funding in conjunction with Mid-State Health Center funding will be used to purchase movable equipment to outfit the 12 exam rooms, staff seating areas, and the reception area.
The total grant request for this opportunity is $176,989, which is 55% of the total anticipated project cost for the outfitting of the space of $321,798. Plymouth, being a rural community, qualified for a 55% grant fund with a 45% match from Mid-State Health Center. This is a track 1 recovery grant. and will be part of the USDA's Emergency Rural Healthcare Grant funding that we applied for earlier this fall.
Thank you, Wendy. Thank you, Bill. Next, we have a portion of our agenda for open discussion, which includes questions and input from the community. So I open up this forum for that. Are there any comments or questions? Hearing none, then I will propose closing the meeting at approximately 10:15. And thank you very much for attending this public meeting for the USDA Emergency Rural Healthcare Grant Program.
Thank you.
Thank you. Thank you.